Now we need to know that what in acute limb, so we have a difference between acute limb ischemia and we have also chronic limb ischemia. Is it clear? Acute limb ischemia and chronic limb ischemia. Now the difference between acute limb ischemia and chronic limb ischemia is that the ischemia in acute limb ischemia generally occurs suddenly. You have a sudden obliteration of a blood vessel. Is it clear? The sudden obliteration of the blood vessel can be total or it can be partial. Is it clear? Here you have a sudden obliteration of a blood vessel, which can be total or can be partial. If you have a total sudden obliteration of the blood vessel, if nothing is done within 6 hours, is it clear? It can be a total. If you have a total, if nothing is done within 6 hours, you are going to have complete necrosis of the tissues at that level. Is it clear? In total acute limb ischemia, if nothing is done within 6 hours, you're going to have complete necrosis. While in partial acute limb ischemia, we can go up to 12 hours or 24 hours before something is done. 12 hours to even 24 or 48 hours before, if something is not done, it can result to necrosis of the tissues. Is it clear? Or it can even resolve by itself. Now in a case of chronic limb ischemia, this is an ischemia that occurs for a very long period of time. Is it clear? In the case of a chronic limb ischemia, it's an ischemia that occurs in an artery for a very long period of time. We have a very long period of time in the ischemia occur in that artery. Is it clear? So those are the two major things that you have to note in acute limb ischemia and chronic limb ischemia. Acute limb ischemia is an ischemia that occurs suddenly in the artery. There's a sudden obliteration of the artery resulting to an acute ischemia, which results to a necrosis, and then all that convert to an arterial ulcer. While chronic limb ischemia, it is a chronic obliteration of the blood vessels by atherosclerosis or by aneurysms or by any other mechanism that is now going to result to obliteration of the tissues, which is going to result to a necrosis after a long period of time and then resulting to arterial ulcer. So that is a difference between an acute limb ischemia mechanism and chronic limb ischemia mechanism. Now we need to go into the clinical relevance of acute limb ischemia and chronic limb ischemia.